Let's keep it going in the KUAM News Zoom room. I think he heard something. We'll bring on Dr. Hoa Nguyen of the Physicians Advisory Group. Good morning, Doc.
Good morning, Chris, Sabrina. Hi, Jason.
Good morning.
So, what'd you hear, Doc?
Good morning.
What'd you hear about the?
Uh, Most likely, I think we're gonna stay in PCOR1.
Oh,
I don't think we're gonna get out this one yet. You know, the hospitalization is still pretty high. We have a few deaths yesterday. I think we still have like 10 patients on the vent. So I don't think the situation slowed down. Clinic-wise, there's a increase in number of sick visits in the past 2 days. There's a few positive cases that out in the community that start to pop up. So I think that we really need some help in the community, and I know people are starting to get kind of impatient on the lockdown, but we still need to really focus on what we do and be disciplined and try to stay at home. Um, I think, as you can see, that the group that have the highest rate of increase right now is the 20 to 40 years old, and those people really need to somehow. One of the physicians say that this we need to identify the problem and educate the appropriate group. I tell you, the group that really bring everything down is the 20 years old to 40 years old. I mean, those are a group that I'm not quite sure what they do, but their rate of increase is still so high that this affect the whole island. So if you guys have a recommendation, let us know. But the 24 years old, they still socialize. They still bring the virus back to their family, and we see that still every day. Because the people in the hospital right now are not the people that are moving around. There's a certain group that bring them back home and affect their own family member. So if you're 20 to 40 years old, please stay home and try not to put yourself at risk, because your risk, you will bring it home to your family. So yeah, I mean, I don't think we're gonna get out of PCOR1 this week yet. So
Okay.
I don't like it, but I don't think we have a choice. So, but that's the governor decision again, But I think that it's hard to get out PCOR1 with a stay-home order when the rate's still in the 20-30 and the hospitalization is still so heavy.
Right. And so the testing positivity rate, because I've noticed that we're not testing as many people as we were before, but the rate, it's still up there, 9-10%. I mean, yesterday it was just about 10, right, Jay? About 10%. So, Doc, what can you tell us about who's getting tested right now? Because we saw on the other day that public health didn't run any. Right?
yeah, it was a zero at the lab. So it was kind of like, why wasn't there any samples or tests ran through the lab or conducted? I want to say was it Monday or
Yeah, we don't have the mass testing anymore, guy. We basically on a test run right now. Mostly people that's sick and come to visit in the clinic. And I know they're going to try to do some target testing, especially on dialysis patient. I tell you, that's the biggest group at risk at this point. Again, the message I've sent I think a week or two ago is that if you have a family member on dialysis, you really have to protect yourself and protect your family member. It's very hard. The dialysis patient, when they hit the GM8, they're gonna stay there for 2 weeks, and there's all kind of chance that when they stay at GMH for 2 weeks, they're gonna get other form of infection because their immune system is so low already that in the environment in the hospital, doesn't matter how clean it is, they're gonna catch something and they're gonna get in trouble because they can't leave to go home. Outpatient dialysis center will not take them, so so they have to go to GMH to get dialyzed. And if the GMH don't have the staff to dialyze those patient will get in trouble. You know, if you have a family member on dialysis, man, I tell you, I would go to work, go home, that's it. No family member come over for dinner or for lunch, whatever, because you got to protect them. Because if we don't, we're going to lose one by one on the dialysis patient.
You mentioned again
Oh,
that 20 to 40-year-old demographic. Do you know like where they are they working, where they may be going? I know Dr. Cabrera was talking about like mobility data. I don't know if that
yep.
tracks, like where people are going or what, but do you guys have any idea
And,
where they're
Sabrina, I can tell you what I see for my patient, right? I mean, that we take a pretty, um, comprehensive history because we want to know what they do. And most of the time, they say, "I just have a friend come over for dinner." It's still the same. They still get together for dinner, and now, like yesterday, a patient, my friend just came over for dinner last week. Now they're sitting there sweating, fever, have a hard time, and those are stuff that, you know, I miss my friend, and I miss, having dinner with my friend. But at a certain point, we had to push that out to them. That they are the main vector right now. They need to be, respect their family, and they need to kind of, socialize in a different way, but they cannot get together for dinner anymore. I mean, that's something that everyone said, "Oh, I didn't know I can get it," and how do I treat it? Say, you don't have no treatment for this one. You go home and you have to stay and hope that it get better rather than get worse. So we don't have the treatment yet. People got to know that. I still ask the same question.
so in terms of the PAG meeting last night. What all did you guys discuss? Did you guys discuss this recent decision from the Superior Court with regard to
Yeah,
quarantine?
yeah. The most we spent a lot of time on trying to push this 7-day test out quarantine for our Q factor, so that way people can go home earlier, right? And that's the main thing. We don't want to keep people for 14 days, and that's quite a long time. And so testing out at day 7, we have no problem at this point. It's feasible. We can do that. The other one that we try to push, the government of Guam and get this thing to go move really fast is get the SARA alert on board. We've been working this thing since March, and no, we really want to put a timeline for them to push that thing. I know they say that they're going to roll out to the end of this month, and they do better tests right now to make sure that it's working and all that kind of stuff. But the SARA alert is a web-based program that the people doing the 7 days quarantine can sign up, and public health can actually verify their address, the phone number, so they have a firm data on the person that they send home from Q Factor. Right now, sometimes people put their phone number there that is not reachable, or their address is not their address. So with this thing on board, at least public health know exactly where you are. You have the right phone number, your right address, and this alert will make you report, your vital sign, your symptom, 2-3 times a day for monitoring. But like I say, I mean, if PAC don't put a timeline, I'm not sure when we're gonna roll it out. So we keep push for a timeline for them. So we really want to see if we can implement this thing the first week of October. But people need to go home earlier.
Right.
Saipan did it. It worked well for them.
Yeah.
So we have to jump on board and move. I think that if anything I learned is that if you don't put a timeline, it's not going to happen. So we want a timeline on this.
Did you guys chew out public health and say, hey, why aren't you guys doing the thing with the court that you were doing before that made the quarantine okay? Because now we're all exposed, and now we got to like open the quarantine jail and set everyone free because public health couldn't do their
Yeah, no,
paperwork.
no. I think bottom line, when you really read it, the judge didn't say that she's not agree with the 14 days quarantine. It's just I don't know, legally or they didn't do the
They didn't do
legal
their
thing. I
paperwork.
guess
Yeah.
Yeah, the paperwork not correct. She didn't dispute the 14 days. The 14 days, she didn't dispute that, but she dispute the way they approaching the paperwork.
Right.
And that's the legal side that I'm a physician. I don't know.
Well,
I
you
just
know
worry
about paperwork
about.
though as a doctor, I'm pretty sure.
Yeah, yeah, yeah. We have to do the paperwork on our physician side that legal. So so I think they just have to change the way they make people sign or tell people to do certain thing, and so it's a different way. So I don't think that she say that 14 days not
Right.
it's not appropriate. So. Um,
But
I
now
know
you
that
guys are
some
looking at
people-
changing the whole thing up to back to the 7-day test out, right?
Yeah, I think that it's nice. Chris Sabrina sent people home early. At 7-day testing out, and we also push for the testing at the airport also on the day arrival. So that way we have 2 tests before we send you home. You catch 90+% of everyone that's positive before you send them home. So and plus with the Sarah Alert on board, the patient can monitor the symptom. When they go home on the 7 days, it doesn't mean that they are free to travel everywhere. They still have to be home quarantined for the next 7 days with Sarah Alert on. So people need to aware that once you get home, they're not free. They still have 7 days at least to be at home.
Doc, did you have any info at all about the 10-year-old boy, Naval Hospital? We haven't. I've been really trying to ask around a lot of different people. Haven't really heard a lot. Did you guys discuss that last night in the PAG?
Yeah, well, the Crystal Serena, that's really we can't get anything out either. I tell you, kids at that age, they don't have that many problems we do. They don't have a heart attack. They don't have kidney failure. The only thing we can figure out is really the 2 most common comorbidity to a kid are either they diabetic, or they have asthma. I mean, that's the odds. The child probably have either one or the other. But it's kind of important for the physician to know if they release it, because the pediatrician need to kind of watch out for that type of chronic illness if the child really have it. It helps the physician community how to manage the children that have comorbidity, and maybe if they have asthma, we have to kind of to monitor and treat the asthma more aggressively in children. So it's important for them to know that. But I think they're going to try to get some information out somehow. But again, it's HIPAA, so the family have to release that somehow. It will help the physician and community to manage the children with the comorbidity like asthma, if that's the case.
Right.
Doc, what about discussions about businesses? I know we kind of touched on it really briefly last time we spoke. You mentioned they were going to be possibly talking about it during the meeting.
We opened that up and no one come up the list yet.
Day.
So the only thing that we really want to push is, when I tell you, I hate to park in the curbside and have them bring the food out. We want to be able to walk in the restaurant, make the order, and then go out in your car and sit there and bring it out to you. It's nice to walk in and look at the menu. So I think it's very safe. Everyone agree that it's safe for us to walk in, make the order, and come out and sit down in your car rather than order online. I don't know. I feel like I'm really ordering food in a restaurant. So
Got to be positive about it, Doc. I mean, you pull up, you sit in, it's like, hey, you're totally getting catered to here. I will take my acai, please.
And a lot of people want to play golf. I'm not quite sure. So.
I know a few people want to play golf.
There's a thing called virtual golf,
Right.
EA Sports.
So that's.
So, Doc,
I think that business-wise, we have to do very slow, guys.
Right.
Truly very slow.
And we get it. So, in talking to you last week, it kind of seemed like the doctors had their homework in the PAG, which is come up with a list of businesses or types of businesses that you guys think we could reopen safely during this PCOR1 lockdown. it kind of sounds like either they didn't do their homework or other more pressing matters like the actual virus response and dealing with the virus took center stage in the meeting. Is that a correct assessment, Doc?
Yeah, there's just other stuff that we talk about. So, but the business one, we do want to open, and everyone uh, put their that 2 cent worth in there. But we all agree that we have to do it very slowly. So, again, we just try to help the restaurant at this point and stay open and stay alive, and the other business will follow as this coming week here to see how the hospital will handle this. And uh, we talked about the hospital. Both hospitals had to kind of work with each other, and it's no longer GMH or GMC. They need to function as one, really, because we have one island, so they need to share resource somehow to make the care better for the patient.
Doc, there have been, I guess, criticisms and concerns from people about these PAG meetings and them not being open to the public. Do you guys plan to ever let the public be allowed to participate or watch or listen in? Or maybe even just once a month allow the community to provide comments. So there's this dialogue and maybe even ideas that you guys can.
So Sabrina, I mean, when we put together a pack, we all agree that sometime when we it's not the purpose to close the pack for no public anything like that. We really, when doing the pack, we really discuss things very freely. There's no, we have different opinions, we have different idea, we have some crazy idea, we have some very safe idea, but we speak very freely during the pack. Remember, the pack is a group of volunteers. We volunteer our time and we try to give the advice to the governor as best as possible. And it consists of all kind of pharmacists, dentists, physicians, different clinic, and we really speak really, really freely. And and what we do, we have another chat group on a provider that we kind of update them, periodically what we talk with the pack, and they give us idea, and we take those ideas back to the pack and we talk about it. Do we keep memo on the pack? No. I mean, I have a secretary that do the minutes so that way I remember what to do. But it's not really not sure legally it's official group because we really all volunteer. We don't get paid a single penny on this thing. All of us spend a lot of time, our free time, cancel my clinic, and I want to do that. So sometimes we invite a physician from the community to come in and to Zoom in and give the opinion. Okay, but I'm not sure if to open out or keep everything officially, like official group that will kind of prevent the physician from speak freely on certain subject to try to move things forward. Sometimes we bash the government official because they don't do the right thing.
Yeah.
But I'm not sure that will be beneficial in the community. Know that we bashing somebody.
Oh, they would love it. The community would love it if they heard you guys bashing on people.
Chris, that's not the thing. We just want to speak freely how we feel, right?
Yeah.
Because, but all we want to do is move our community forward on this pandemic in a safe way. So, and so I don't know what the right thing. I'm not in the politics. I'm just a physician.
Let me ask you this then, Doc. What if the governor said, "Oh, we got to be transparent now, guys. We're gonna carry these PAG meetings on the governor's Facebook page. We're gonna live stream it." Would you still be in the PAG?
I mean, if we have to do that, we have to do that. But again, the physician and the member probably will not be so open and not be to speak freely on their thoughts. So I don't know. Either way, we do wish a way that the governor won. I said, again, you gotta understand, it's a group of volunteers, and the governor have a choice to listen to us or not. She make the final recommendation. Again, she really none of us benefit anything from it except that we all have our heart to move the community forward. It's a lot of time, guys. It's a huge
Right.
amount of time that we spend there, and it's just like I say, all volunteer. I just lost one physician, and it's I have a very hard time finding a person that want to spend the time away from the clinic, the family to sit on those boards. Because it usually take 2 hours twice a week, and then we spend more time on the side talking.
I did.
So
I did have one more question, and it goes back to that 20 to 4-year-old demographic, and when you had asked, what else, right? We can do about this. So, to me, is this just kind of an admittance that this whole stay-at-home order hasn't been working over the past month? That we can't get these 20 to 4-year-olds to do whatever it is that apparently it doesn't appear like they're sticking to the stay-at-home order since we're still seeing these positives. And if in fact that's the case, do you see the PCOR1 restrictions being even more, or do they need to be more stringent? Do we need to have roadblocks? Do we need to have a curfew?
Sabrina, that's the $1 million question. It's a thing is that I think we need to do some better education for that group, the 24 years old. I mean, we just need to educate them, put something out, on the PSA something. We got to approach it a different way, because whatever we do right now, it doesn't work for that group. Everyone get the message. I tell you, the comorbidity, people with comorbidity, they know it. They stay home. That's not the problem. We need to somehow approach this 20 to 40 years old in a different way in order to carry the message across to them. Right now, yes, I agree with you. The stay-home order right now that doesn't work with them for whatever reason is, but we have to take look at that and see what happened. But like I said, if anyone have any idea, let us know. You guys let us know how to approach this special group of people in 2040 and tell them, hey guys, be different. Be respectful and be patient. And respect people around you and care for your family somehow. But if you guys come up with the idea, let us know. We open for suggestion on that one. But that special group really have to be very careful. Again, if you're 20 to 40 years old, you really have to pay attention, because everything go up and stay up just because we're missing something in that group.
Right. Doc, I'm totally here for you guys. Give me the Zoom link for Thursday's PAG meeting, and I'll jump in and I'll give you some ideas for how to mark it.
Okay, Chris. We'll keep that
between us. So keep it between us, okay? I'll just be lurking in the dark. Okay.
Okay, guys.
All right.
That's it. Just be safe and stay home, guys, and learn to appreciate things that we have. Okay.
Thank you, Doc.
Thank you.
Takeaways from Dr. Ho. We'll see you. Wash your hands.
Thanks, Dr. Ho.
Takeaways. He seems to think that we're going to see an extension of the PCOR1 lockdown.
Mm-hmm. Yeah. So that could mean